Good morning, everyone. My name is Nicolas Fortanet. I'm a sociologist at INRAE, which is the French Research Institute for Food and Agriculture and Environment. And I'm very pleased to chair this session this morning. I'm sorry, we have a little technical issue. Just a second. Yeah, sorry, I was double hearing me. So yes, again, so I'm very pleased to chair this session this morning, and thanks everyone for being there. So first of all, I would like to thank, of course, the organizer of the conference to have made that possible, to invited us, and the 4 projects that will be discussed this morning. And also, I really would like to thank the communication and dissemination teams of the 4 projects who've been working a lot to prepare this, and in particular, Duru Eruglu, who's working in Roadmap, and without which none of this would have been possible. So this morning we are actually going to present and discuss 4 H2022 projects which have been recently funded by the European Commission on the topic of antimicrobial use in animal production. We are 4 different projects, very complementary, all the time interdisciplinary, multi-actor. So we have various approaches and angles to tackle that question and issue of antimicrobial use in animal production. And we think that the synergy of the 4 projects is very rich. So we are very pleased to have organized that all together and to be able to put into discussion basically presentation, but also first results of the project, because you have to keep in mind that they are still ongoing and for some of them quite recently funded project. So there are the Roadmap project, which I am coordinating, which means rethinking of antimicrobial decision systems in the management of animal production. We have the AVANT project, Alternatives to Veterinary Antimicrobials, coordinated by Professor Luca Guardabassi. We have the DISARM network, Disseminating Innovative Solutions for Antibiotic Resistance Management, which is coordinated by Erwin Wouters. And last but not least, HealthyLivestock, Reducing Antimicrobial Use Through Improved Livestock Health and Welfare, which is coordinated by Hans Polder. So you may have seen that already on the program, but this is how it's going to work. We will have a brief introductory session where the 4 projects are going to be shortly presented, and then we will have three sessions where we're going to discuss 3 different topics or themes. The first one being on social, economic, and regulatory factors of transitions, after which we're going to have a short break, and then we're going to discuss about promising technical innovation to reduce antimicrobial use. And finally, we will talk more largely about stakeholder engagement and impact. And we're going to listen to a couple of presentations in each sessions, after which we will have a Q&A sessions, which I will chair. So I guess we can start already with a short presentation of each project. So you can launch the video. Hi, my name is Nicolas Fortanet. I'm a sociologist at INRAE, the French Institute for Agricultural and Environmental Research, and I'm the coordinator of the Roadmap project, which I'm going to present now. Roadmap is a H2020 research and innovation project funded by European Commission. And I think its objective is quite well summarized by its title, which means rethinking of antimicrobial decision systems in the management of animal production. What it basically means is that we are implementing research and development activities aimed at promoting transitions toward rational and prudent use of antimicrobials in animal farming. Roadmap articulates different approaches from social sciences and economics to interdisciplinary and multi-actor approaches. We are a large consortium of 17 partners, including universities, veterinary schools, and stakeholders from 9 European countries.
The project is dividing into 4 pillars, fed by case studies taking place in diverse sectors, production systems and countries all across Europe, of course, but also a couple of low and middle income countries. The first pillar provides a socio-economic analysis of, on the one hand, the structural drivers of antimicrobial use, such as regulatory systems, structures of the food and drug markets, or public and private standards. And on the other hand, an analysis of behaviors, knowledge and motivations of animal health professionals such as vets and farmers. The second pillar implements interventions through a participatory device that we call living labs. It will put together stakeholders and researchers to co-construct strategies to promote prudent use of antimicrobials. The third pillar will assess those interventions and design impact and transition pathways, helping to define roles and responsibility for everyone to encourage global change. Global, but also adapted and tailored to various contexts, situations, and production systems. The fourth pillar will interact with all the other ones to strengthen our communication and dissemination, and also to maximize stakeholders' engagement all along the course of the project. So of course you will know more about all of that in due time so that you can participate in and contribute, but you can already follow us on our social media channels and through our main website. So I'm looking forward to getting in touch.
Hi, my name is Luca Guardavassi and I'm professor in One Health Antimicrobial Resistance at the University of Copenhagen. I'm here to introduce the EU Innovation Action AVANT, which is a project supported by Horizon 2020. The AVANT consortium is composed of 14 partners, including 5 universities, 8 enterprises, and 1 large European veterinary association. This is a so-called multi-actor project that brings together experts from academia, industry, and veterinary practice to work together towards a common goal. The goal is to develop and test innovative alternatives to antibiotics to reduce the overall consumption of antibiotics in livestock production. We decided to focus on pigs because this is the animal species where most antimicrobials are used, in Europe at least. And we specifically develop and test alternatives for control and treatment of post-weaning diarrhea, because this is one of the main indications for antibiotic prescription and use in pig production. It's a very common disease that affects piglets at the age of 3-4 weeks when they're separated from their sows. And it's very difficult to treat because of the restrictions in the use of zinc oxide and colistin, which were traditionally the first choices for treatment of this bacterial infection. The AVANT portfolio includes 4 types of alternatives to antibiotics. The microbial gut modulators, which are like good bacteria that antagonize the pathogenic bacteria in the intestinal tract of the pig and also contribute to improve the host immunity. The second type are medicines that are specifically targeting the main pathogen responsible for post-weaning diarrhea in piglets, enterotoxigenic Escherichia coli, using phage or polymers that are specifically killing this organism. The third type are immunostimulants, which are substances that activate the immune response of the pig and against all pathogens, so they confer a general protection against all bacterial diseases. And finally, our portfolio also includes different types of nutrition strategies targeting either the sow or the piglets to produce healthier piglets that are less predisposed to post-weaning diarrhea. The different products that we are studying are at different stages in the development process. So some of them are already formulated, whereas others are at earlier stages of testing and production. We expect that the most advanced ones will be translated into farm practices within 1-2 years after the end of the project. And this will have a great impact on livestock production. In particular, farmers and veterinarians will be able to produce healthy animals with minimal use of antibiotics and without impacting their profit. And the consumers and the society as a whole will also benefit from the outcomes of this project, because a reduced use of antibiotics is likely to result also in a reduced risk of transmission of AMR from livestock to humans. So see you in 4 years. At that time, I will probably be able to bring some good news about alternatives to antibiotics and responsible use of antibiotics in animals. In the meantime, thank you very much for your attention, and I look forward to meeting you face to face in the near future. Goodbye.
The DISARM project aims to reduce antibiotic resistance by reducing the need for antibiotics in livestock farming through a focus on disease prevention and good animal health. DISARM is a European Horizon 2020 thematic network project running from 2019 to 2021. We work with multiple actors across different countries and livestock sectors to share the most cost-effective and beneficial strategies to improve animal health, reduce antibiotic requirements, and thereby reduce antibiotic resistance. We could use your help in collecting and disseminating these strategies. We have already collected various best practice techniques and innovations. Our website and community of practice on Facebook are now filled with a bunch of practical videos and abstracts, literature, useful toolboxes, webinars, and other events. This is all to spread practical knowledge in the field of antibiotic reduction in livestock farming. We haven't finished disseminating knowledge. Videos will be made and events will be organised. Would you like to contribute to these activities? You could share your innovation or get your own networks involved. Please just let us know. Let your innovation count on the DISARM stage.
Hello, my name is Hans Polder and I work at Wageningen University and Research. I'm the coordinator of Healthy Livestock. Healthy Livestock addresses antimicrobial resistance, a problem for human and animal health. Antimicrobial resistance is mainly caused by the overuse and abuse of antimicrobials. And antimicrobials are, for example, antibiotics and anthelmintics. In our project, we aim to reduce the need to use these antimicrobials, and we want to do that by increasing the level of welfare and by increasing the level of health of pigs and broilers on farms. And we do that through 4 complementary strategies. The first strategy is to help farmers to increase the biosecurity on their farm. Because if biosecurity is high, then the chance of pathogens entering the farm will be low. Secondly, we aim to increase resilience of farm animals. And you can do that by, for example, reducing stress levels or altering the diet. Animals with increased resilience will be more able to withstand infections with mild pathogens. The third strategy is to detect animals that are ill as soon as possible. And this can be, for example, by recording, by observing behavioral changes of animals. An early detection of diseased animals will allow for precision medication of those animals or those groups of animals that are affected. And this avoids that you have to use medication across the whole herd. Antimicrobial resistance is a global problem, and our European consortium has teamed up with experts in China which address the problem in the same way as we do. The consortium consists not just of academics, but also of industry partners which own a large number of farms, and of partners that are active in the veterinary industry. And together, in China and in Europe, we want to improve the lives of animals and humans by increasing animal welfare and reducing the risk of antimicrobial resistance. We'd like to acknowledge the funding that we receive from the Horizon 2020 program of the European Union, as well as from the Chinese Ministry of Science and Technology. Thank you very much.
So wonderful. So now we're gonna open the first session on social, economic, and regulatory factors of transitions, as I said, and we're gonna start again with a little video from me again, entitled "What Can Social Sciences Say About Change and Transition: Behavioral and Structural Drivers of Antimicrobial Use and and socioeconomic drivers of AMU and alternatives." And just, I would like to apologize very shortly, because when I registered this video, I was not fully understanding everything. So I'm going to present again more or less the whole project, of course, in a much deeper and longer way. But during the Q&A, we can focus actually on the first part of the project, which is definitely about those socioeconomic and regulatory factors. So yeah, let's go for it.
Good morning, everyone. My name is Nicolas Fortanet. I'm a sociologist at INRAE, which is a French research institute for food, agriculture, and environment. And I'm the coordinator of the Roadmap project, which means rethinking of antimicrobial decision systems in the management of animal production. And I'm very pleased to be here today at the Responsible Use of Antibiotics in Animal conference. So I'm going to briefly present you this project, which is a Horizon 2020 project funded by the European Commission. And it has started already 2 years ago in June 2019 and will last until May 2023. We are 17 partners and we are conducting research activities in 10 countries, including 2 low and middle income countries. So the main goal of Roadmap is to encourage transitions toward prudent use of antimicrobials. And the project is broken down into 4 pillars. The first one being driven by social sciences and aims at understanding the drivers of antimicrobial use in a variety of contexts. So basically we focus and analyze the behaviors of various stakeholders and also the influence of regulatory system on antimicrobial use, but we also have a look at a more micro level on the knowledge, practices, and motivations of animal health professionals. The second pillar, which is rather driven by participatory approaches, aims at co-developing strategies with the stakeholders to encourage prudent AMU. So here, basically, we focus both on technical tools and means of behavioral change, but also have a look on how we can develop socioeconomic and policy instruments that can foster those transitions. Then the third and fourth pillar are rather designed around the notion of assessment and impact. And basically here we want to, of course, evaluate all those strategies that we will develop, or we are currently developing within Pillar 2, but we will also co-build and co-design transition pathways and scenarios towards prudent antimicrobial use. And of course, we have various activities in terms of communication and engagement with stakeholders. So globally, I could say that this project carries approaches in terms of systems and transitions. And what does it mean? Basically, it means that we do not only focus on individual or behavioral change, but we are also mainly focused on the structural component of change and transitions. And as a consequence to that, we also don't only look at technical innovation to replace or reduce antimicrobials, but we also try to have a deep understanding of multi-level transitions, which I'm going to explain a bit further.
Very briefly, you could see here basically the structure of the project and how the various pillars are interconnected, but I also would like to emphasize the fact that we are an interdisciplinary and, as I said, a multi-actor approach project. So basically we are a large community of both social scientists, which includes sociologists, economists, and specialists in management, but also animal and veterinary scientists. And as I said, since we are a participative project, we also rely quite a lot on the stakeholders' expertise. What is important as well here is that this project is really organized around case studies, national case studies, which are directly feeding the various pillars and work packages of the project. So you could see the list of the countries that are involved, the list of sectors that we are focusing into, and how we have basically conceptualized the distinctions between various production systems, various contexts that we call intensive system, alternative systems, and marginal systems, because we strongly believe that there is no one-size-fits-all solution to reduce antimicrobial use or to foster prudent use of antimicrobials, and that it is very important to adapt and tailor basically solutions to a large variety of contexts, and that allows us as well to develop some kind of critical reflection about the porosity, entanglements, and interactions between those various agri-food systems. So I will explain a little bit with more details what we do in each pillars and work packages. So as I said, the first pillar is driven by socioeconomic analysis, with a first work package dedicated to understand the structural drivers of antimicrobial use, where we have various tasks, including assessing usage in every case study, thanks to local monitoring systems, analyzing the impact of a regulatory system and public regulation, both at the national level, but also the European legislation, including the new regulation on veterinary medicines. We also study the role of private standards and guidelines, such as antibiotic-free labels, stewardship programs, and we also have a task that is dedicated to what we call stakeholder mapping. So basically, where we try to understand at a large level the role and influence of what we call the big players, and try to describe their behaviors, power, and strategies regarding the use of antimicrobials. The second work package of this first pillar is rather driven by sociological approaches and looks into practices, knowledge, and motivations of animal health professionals. Basically, we have here as well various activities that includes quantitative and qualitative surveys, and here we were trying to understand but also to compare the working conditions and business models of farms and veterinary practices, the role of antibiotics in the farming and veterinary practices, and as well the influence of professional ethics and identity on perception and motivations for antimicrobial use change. The second pillar, as I said, is driven by participative approaches, and here we develop what we have called living labs, which are basically a participatory device where animal health professionals, stakeholders, public authorities, but also scientists gather to kind of co-construct strategies to foster prudent use of antimicrobials, and where we hope and we are really dedicated to try to empower those actors towards those objectives. And of course, there are living labs in all the countries that are involved, but since it's really like some kind of bottom-up and participative approaches, each living lab ends up with kind of a specific topic that makes sense and is deemed as a priority for the local actors that make live, basically, this lab. The third pillar, which is rather dedicated to impact and transitions, as I said, aims at first to perform a global economic assessment of the policy measures, also to evaluate the living lab strategies, and to develop some kind of participative assessment of the impact of these strategies. And in the end, we will co-build with the stakeholders, with the animal health professional, transition scenarios that, as I said,
are tailored to various contexts and production systems. And if you want to basically understand a little bit further how conceptually all the activities of this project are framed and organized using like these theories about multi-level transitions that are quite a lot developed now in the literature, I would say that our case studies basically try to analyze and understand rather the regulatory context and the sectorial context, while our living labs, which are really those bottom-up kind of approaches, are really here to empower actors at the local context. And so basically the overall basically of the project will allow us in the end to assess and understand and co-build those global transition and impact pathways. Finally, we also have, of course, a fourth pillar, which is dedicated to communication, dissemination, and, as I said, stakeholder engagement. And we have here various tools to basically drive those objectives. Yes, that's all for me now. I'd be happy to answer to your question, and we will be pleased if you want to have a look at the website of our project. Thank you very much.
Well, now I'm going to introduce the second speaker, who is Dr. Klaus Hellmann, and who's going to talk about regulatory pathways for alternative products to antimicrobials. And just before we launch the video, I just would like to remind you that you can start to put your questions in the chat box or in the Q&A little tool that you have on the platform. So don't hesitate to start, putting questions. I will receive all of them, and then I will chair the session with your questions. So let's go.
Hello, thank you for the invitation to give a presentation on the regulatory pathways for alternative products to antimicrobials. Upfront already, I would like to thank my co-author, Dr. Sabine Richter of our team in Munich of GlyphoVet. Talking about these topics, I would like to start with some definitions, and that is about antimicrobials and their alternatives. Antimicrobials are substances with a direct action on microorganisms. They are used for the treatment or prevention of infections or infectious diseases. This includes antimicrobials, antivirals, antifungals, and antiprotozoals, and is broader than the term antibiotics, which are substances with a direct action on bacteria that are used for the treatment or prevention of infectious diseases and infections. And with that definitions are always veterinary medicinal products. CVMP, the Committee of Veterinary Medicinal Products of the European Medicines Agency, has also given a definition on alternatives to antimicrobials. In their view, these are veterinary medicinal products, the use of which provides an alternative approach to the use of antimicrobials in animals, or that reduce the need for their use. However, they certainly can also be potentially alternatives to antimicrobials, basically that do not fall under the term of a veterinary medicinal product. And we'll go into that in a few seconds. So the CVMP, as just quoted, gives also examples for typical alternatives to antimicrobials, which are first of all and predominantly currently on the market vaccines. And we all experience that at the moment with the COVID-19 crisis. Also antibodies, sera, immunomodulators, and interferons, bacteriophages as well as lesions, antimicrobial peptides, CRISP technology-based products, prebiotics, but maybe also pro-sim or postbiotics, phytochemicals, herbals or botanicals with certain activities, organic acids, probably with a different mode of actions, biocides, teat sealants, though there's a lot of variability that could potentially be useful to avoid the use of antimicrobials under certain circumstances. So they can fall under the definition of feed or feed additives or veterinary medicines, as already mentioned. But both classifications, either feed or veterinary medicines, will basically then have different requirements to obtain a marketing authorization or place them on the market. So a feed additive, these products would normally fall under a zootechnical feed additive class. And these are substances, microorganisms, or preparations that are intentionally added to feed or water with a certain purpose. A zootechnical feed additive favorably affects animal production, performance, or welfare, particularly by affecting the gastrointestinal flora or digestibility of feeding stuffs. Feed additives affect the performance of healthy animals and are not meant for use in animals that already show disease. And they are based on the legal framework of Regulation 178/2002, which is already based on the White Book of the Codex Alimentarius. Specific regulations on feed in Europe is the Regulation 767/2009 on the placing on the market and use of any feed products. Regulation 1831/2003 basically defines the requirements for additives for use in animal nutrition, while the Regulation 429/2008 gives further requirements for the presentation of applications and the assessment and the authorization of feed additives. And finally, we have a relatively new regulation, 2019-1381, the so-called transparency regulation, which basically gives further directions how to handle studies and that they have to be put in a register that is hosted at EFSA if they want to, if these studies should be used for the purpose of a marketing authorization. The way to market for a feed additive in the EU is described in the regulations as just mentioned. And the applicant has to provide a dossier including data on quality, so the manufacturing, the safety and the efficacy of such product. All the information on studies needs to be entered on the EFSA platform, but also be part of that dossier for marketing authorization, as well as that you have to send methods with a description and samples to the European Reference Laboratory. The European Food Safety Authority is responsible to evaluate such dossiers and provide a scientific evaluation, which is the basis of the European Commission to grant a marketing authorization. In AVANT, the Horizon 2020 project on the alternatives to antimicrobials, we are working on different products that would potentially fall under the definition of a feed additive. One is a probiotic product consisting of microorganisms. Another one is a biopolymer obtained from chitin. And another one is basically are bacteriophages-based products which are obviously then used to attack the bacteria. Switching to the veterinary medicinal products, these are substances or combinations thereof that treat or prevent a disease or restore, correct, or modify physiological functions. And we differentiate based on the new veterinary regulation that comes in force in January next year, the Regulation 2019-6, pharmaceutical or non-biological veterinary medicinal products, as opposed to biological veterinary medicinal products, which are then separated either with an activity that is defined as non-immunological or immunological. The way to the market works through the European Medicines Agency, and the applicant has to provide the substantiated dossier, including data on quality, safety, and efficacy. So similar, but with different requirements as a feed additive. The European Medicines Agency is then responsible for the scientific evaluation before the European Commission can give the marketing authorization. In AVANT, we have, again, different products that could fall under the definition of a veterinary medicine, especially if any claims for treatment or prevention of disease are made. One is an immunomodulator, which is a purified lipopolysaccharide from Orchobactrum intermedium. The other one, as already mentioned under the feed additive categories, are bacteriophages. The intention here is to rather register it as a feed additive, but it may also be a veterinary medicine. This is explicitly mentioned under the novel therapies that are provided or where specific requirements are provided in the new Regulation 2019-6. The major differentiation is most likely based on the claims, presentations, and intended use, if this will work as a feed additive or a veterinary medicine. So some last words on the practical way to replace antimicrobials. The CVMP of EMA considers vaccines as the most suitable or alternative to reduce the use of antimicrobials. And in COVID-19, we see that antiviral drugs fail to treat the disease until now, that no diet can prevent or treat an infection, and a vaccination is today the only proven strategy to fight the infections with COVID-19 or the seriousness of the disease. Yes, that's already the end. Thank you. The coronavirus kills mink, and we'll also see that. Certainly, we see already companies developing vaccines for animals, as they may, of course, also have a potential for zoonotic infection of people. And one of the major ones are minks, but there are others, especially on the feline population, that may also be able, that the coronavirus is replicating there. On the other hand, I guess we all know that coronavirus is nothing new in animal health. So we have coronaviruses in nearly all the different species that we know of. And therefore, the skills of the veterinary medicine are probably quite useful to develop the right strategies for treatment and prevention of coronavirus. I thank Professor Luca Garavasi as the project coordinator, who is doing an excellent job to harmonize the approach to all these different technologies. And as already mentioned, my co-author Sabine Richter, who supported me in preparing this presentation. Thank you.
So thanks a lot, Klaus. And now we're gonna move directly to the last presentation. And I would like again to remind the newcomers who have joined us like recently, don't hesitate to put questions in the chat box or in the Q&A session of the tool. But before that, let's listen to Helena de Carvalho Ferreira, who's gonna talk us about the experience with the interactive innovation approach and multi-actor projects.
Good morning. I would like to present to you what has been the experience of the interactive innovation approach and multi-actor projects in the context of DISARM projects. My name is Helena Ferreira. I work for ILVO, and the project DISARM is based on disseminating innovative solutions for antibiotic resistance management, and this has been presented earlier by our project coordinator, Erwin. And I will just try to explain a little bit what we do within DISARM in the context of the interactive innovation approach. So I would like to take you through the presentation, in which we will be going through from the topic of what is innovation, what type of approaches should we consider to innovation, what are the benefits of the bottom-up approaches that we are presenting here, and then of course having the multi-actor networks in action, so the agricultural knowledge that is going to be shared in innovation systems, and then the acronym, so explaining the acronym ACIS. The DISARM project also has strategies and challenges that are inherent to it that are interesting to showcase how these networks can be put into action. And then eventually we'll be moving on to the importance of facilitation. Why is facilitation a big aspect of these type of thematic networks, and what are the components of facilitation, and what can researchers do to facilitate? And finally, I would like to present to you what is then the summary of the multi-actor approaches that DISARM has had so far. So first we come to the question, what is innovation? Innovation is the result of a process of networking and interactive learning among an heterogeneous set of actors. In this case, we have farmers, input industries, processors, traders, researchers, government officials, and civil society organizations. Innovation then has to go from one part of the whole to the other, and the fact that it's heterogeneous poses some issues. So conventionally, we have approached innovation from a top-down approach. So that meant that there would be scientific expertises that would be accumulated, and then that would be passed on into agricultural extension and eventually to farming. But what we've concluded is that the local knowledge is essential for local innovation. So this innovation will require creating a space for joint learning. There should be knowledge sharing. We should be bringing together different actors and allowing for different forms of knowledge to emerge and not just science. So the alternatives to conventional top-down knowledge exchange have emerged, such as bottom-up joint learning between scientists and farmers. So how do we stimulate this? We stimulate this by creating participatory bottom-up approaches, such as the stable schools. That's an example from Denmark, in which they started by having common experiential learning, and they created facilitated discussions on farms, and this led to the co-creation of action plans. So we have to bear in mind that this practice-led innovation is then coming from the experiences of doing rather than just having the accumulated knowledge, and then adapting these experiences to the daily challenges, which are arising from strategic context. And it's important to bear in mind that these are in practice on farm happening, and that is why the demand for innovation is occurring. So innovation in these practice-led approaches emerges from the social interactions in the cultural context of individual farmers and their management strategies, and not necessarily from scientific research processes. In doing this collaborative interactive approaches to innovation, what we generate is that a situation in which the farmers themselves become more on equal footing with the scientific knowledge coming from the researchers. This is important because the challenges that are addressed by these innovations are often multifactorial challenges, and a lot of these challenges need to integrate the different parts of the system, taking into account, because what is the point of generating knowledge that is not implemented? So there has been a growing interest in policies moving from a more conventional top-bottom approach to a more alternative, more collaborative, bottom-up, practice-led approaches to innovation in Europe. And of course, they respond more quickly to the demand from innovation, and the way we could be solving local problems using practical knowledge and creativity at the farm level itself. So this then leads us to the interactive innovation approach, in which we have the agricultural knowledge and innovation systems that it basically allows for a possibility for knowledge to exchange between people and organizations within a country or region. And it will include the farm practices, the businesses, the authorities, and research. And what is crucial here is that the farmers become experimenters and experts, whereas the researchers are not just passively transmitting the knowledge, but they actually become capacity builders and facilitators of learning. And this is a big change from the position that the researchers might be imposing their knowledge onto the farmers without actual full comprehension and full application of this knowledge, and then therefore leading to a resistance in the implementation of this knowledge. But by involving the farmers, making them also experts in the topic, then they have ownership of the topic, and then they will be implementing the changes much more quicker. In DISARM, we've tried to bridge this significant gap between scientific research in applied science into farm practice, because we believe in the practice of practice-led innovation by creating a thematic network and providing a tool that collects scientific knowledge and best practices, facilitate their use by creating materials that can be easily disseminated, such as information sheets and audiovisual material. Some of the strategies within the DISARM that we identified to reduce antimicrobial resistance were improving animal health status, improving farm biosecurity, targeting the use of antibiotics, and alternative treatment strategies. DISARM is mostly focused on the larger sectors that account for most of the antimicrobial use, so that's pigs, poultry for meat, intensive dairy, and the grazing livestock sector. The goal is to share the best practices across the whole livestock sector, and that they could also learn from each other. And here we identify a few challenges. So we have first a multi-actor challenge in which we have to actually bring together the farmers, the advisory services, and the researchers and industry to share and debate how the antimicrobial resistance can be accomplished, how reducing antimicrobial resistance can be accomplished. So that will be the multi-actor challenge. And then we have the specific AKIS challenges, which are resulting from the strategies and innovation that have to be disseminated to as many farms as possible. And then we have the facilitating changes in the farming systems, which have been embedded in the farming industry for many decades, which leads us to the social challenge, which is to change the way that farming has been done in this farmer's lifetime. Then we move to the communication challenges. So we also have to disseminate innovation in a way that the farmers can understand with succinct and clear language. Then we have to also understand that creating awareness in antimicrobial use is a long-term investment, and that will lead us to a long-term journey challenge. Finally, I'd like to bear in mind here that this researcher is also the facilitator of change. And this brings me to the importance of facilitation. So facilitation is the process of making something possible or easier. And there are many needs for facilitation, namely empowerment, innovation, connectivity, cooperation, support. And these are all going to be the role of the researcher or the knowledge, the person in charge of the facilitation in this case, which should be a researcher. And we also have to bear in mind that in a farm, no one knows a farm better than a farmer. And then we will create basically the right amount of feedback between farmers and researchers by creating a safe space where they can have group discussions and we can share their information. And this is something that has to be adapted to the farm itself. So just to summarize, in the DISARM, we've been trying to share and present the existing practice and research findings through a series of best practice guides, abstracts, videos. We've also been trying to look into the cost benefit of new practices. We also are trying to develop a state-of-the-art database in which we collect all the information that we find relevant for the researchers and the farmer and industry. We've been widening the existing networks, such as InZLTO, IFA, and GoPagor, and so that can also network with additional farmers. We've been doing cross-fertilization, the end-user materials, which will be presented in another session. And finally, we have this multi-actor approach that we're quite happy with, and that involves this facilitation, which will also be the topic of another presentation, and we also have links to operational groups. Our partners are included in this slide, and we have partners from all over Europe, from Northern, Southern, Eastern, and Western Europe, and Ilvo is the one who's been leading this project. And for more information, please go to our website. Thank you very much.
Wonderful. Thanks again for these very clear presentations. Let's start the Q&A session. We have a little bit more than 10 minutes. I'll try to wrap up a couple of questions first for Klaus and Helena, and then maybe keep one for me in the end. So yeah, for AVANT, I mean, people have been wondering, you've been presenting various regulatory paths depending on the type of medicines or therapeutic solutions, but do you think there are ones which could be easier, quicker, and does those regulatory paths actually can influence or drive like research, depending on the fact that it could be easier to get market authorization for feed additive rather than medicines or whatsoever? So in a project such as AVANT, but especially that you have multiple companies that are partners of this project, how does possibly influence actually the research?
Well, obviously, the technology that comes out of research, well, you have to fit it into one of these kind of legal pathways to place it on the market, because otherwise you may end up in a kind of an illegal situation, which is obviously not helpful. So that may even already apply to the research you are doing, but of course, research has a little bit of more freedom than commercial use of products. Yeah, in principle. but definitely it does influence it, and it is quite a challenge, or has been quite a challenge to define the products in sufficient detail that you can then also define the regulatory requirements that you then have to fulfill. And as we get as we are sponsored from the European Commission, obviously we need to be compliant with the legislation, what we do. So yes, there is I think there's, especially the scientists probably feel it as a quite restrictive set of legislation where we are working. So, I can fully understand your question there, and it has an impact, yes, no doubt.
Yeah, and you haven't talked much. I mean, I understand that it's not like something necessarily central in the project, but about alternative or complementary medicines that we talk quite a bit as well to reduce or replace antimicrobial use. And do you and we know that for some of these types of approaches or therapeutics, the regulatory pathways are very blurry at the moment. It's quite difficult to know whether it's a drug or not. You know, I'm thinking about aromatherapy and essential oils or things like that. And I'm wondering whether you have a comment on that, on the fact that we are in a situation where the regulatory aspect of those kinds of possible solution could hamper some way, maybe the development of those solutions.
Well, I think you have clear definitions of these products. That's where we are coming from. So for veterinary medicine, if you have a whatever aromatic oil, that's fine. But if you want to license that, well, if you apply that topically, you could argue it is just a product for care, and these products may not be that strictly regulated. But if you want to make claims, medicinal claims, and wherever you argue that you replace an antimicrobial, so wherever you talk about an antibiotic, it's just set in the legislation that it is a veterinary medicine. So all the other arguments are not fitting. So of course you can escape if you don't make these claims. So you can be a veterinary medicine by presentation, and the other is by the action, so mode of action. So by presentation, it's pretty easy. You just have to put on your product that it is for prevention or treatment of disease, and you are veterinary medicine by definition. So you cannot escape that, but you can escape it not making these claims. So and what we see there, of course, everybody these times, there are lots of startups, and lots of startups have good ideas. Yes, and they want to have a big market and a very high profit market. And then people try to get into kind of this area of a veterinary medicine, but they don't want to follow the rigid requirements that you have to. So there is a conflict of interest. On the one hand, you want to make a big deal commercially, and on the other hand, for that, your product needs to be effective, because otherwise you're cheating the consumer. And that's definitely not what we wish. So the expectations on these products, which you often see under, I would say, in vitro conditions, is often not playing out under in vivo conditions in the target species. And there are different reasons why. And we have seen multiple things why certain products failed. One were that, calculations of MICs were completely done wrong. So you couldn't reach the true concentration of an active that has at some concentration some antimicrobial activity. Yes, of course, if you put a bacterium into oil, most of them are not going to survive. That's clear. But at the same time, you can't have 100% concentrated oil in the intestine, because the animal will not feel that.
Of course.
You cannot create that under in vitro conditions, and we. Not in this project, but that is my other experience. So we have seen lots of these things where they are just misconceptions. Yes, there is some data available, but then under practical conditions, it's just not feasible.
Okay. Thank you very much for that very clear.
Others,
precise
so you have to address very early and categorize where you want to go, because otherwise you also spend a lot of money for studies that are useless at the end, because you are just getting into a dead end, I would call it.
Thank you very much.
Regulatory advice is very important.
Absolutely, and your answer shows how like the regulatory and market issues are instrumental in some way to foster innovation.
Borderline product, and some products you can place yeah, as a veterinary medicine, you can place even sometimes as feed, and then I would normally go for the least requirements for a product. But that has implications on claims and commercial impacts, of course, at the end. Yeah.
Thank you very much, Klaus. Helena, people were wondering, I mean, how you, I mean, we have understand, I guess, how bottom up and participative this project is, but how do you take into account the variability of farming conditions and socioeconomic backgrounds of the farming systems and of the farmers? In particular, do you work differently with farmers who belong to a quite integrated, food chain, who sometimes cannot take all the decisions by themselves, compared to more independent type of farming? And in the end, have you figured out or tried to imagine like various protocols or methods in terms of how to engage with these farmers, depending on this type of socioeconomic kind of structure of the food chain they belong to?
Yeah, thank you for that very clear question. Well, part of the answer will be answered by my other two colleagues that are going to present sections on DISARM work, particularly the farm health plans. It's something that we're quite happy with, and I try to explain a little bit how, or at least set the stage, let's say, for the presentation of Anik on this topic. So in the farm health plans, we believe that the different farmers will have a different needs, as I explained earlier in the presentation. And we have developed, say, a framework in which we allow the facilitator to set the scene, let's say, to bring different actors on a meeting. And during this meeting, we have a very clear structure of the what we call the Plan, Do, Check, Act. And this is a series of steps that could be adapted to the different needs of the farmers. And indeed, we have in our farm health plans, we have a wide range of working conditions. So we have integrators, pig integrators. We have extensive farming, also of sheep. We also have farmers that are more working towards a biological, let's say, organic farming type. We also have farms that are that will be exchanging these types of knowledge between themselves, so as to also bridge the gap of understanding between the different systems, so that they can also learn from each other. Actually, one of the important parts of DISARM that we're quite happy with is that once the amendment has been confirmed, we will be able to do visits between different countries, and in these visits will also be possible that sheep farmers in France will communicate with sheep farmers in Greece, which is really nice, because we also found actually people in France that can speak Greek, which is great.
Wow.
So we're very happy with that. And the idea is that they will actually go there and communicate with their farmer, with other peers, let's say, how they do things, and maybe learn from that experience into something that they can apply in their own system. So yeah, we understand that having a very strict framework would not really lead to any change. So we have a bit of a loose framework that allows us to impact change by having these very defined steps: the Do, Plan, Check, Act, and then also having the farmer and the feed advisor and the veterinarian, and eventually a facilitator, which is usually a researcher from DISARM, doing and trying to glue this type of knowledge together. Mm-hmm. But on a very human level, let's say, not very distant and not very academic either. At least that's the goal.
Okay, thank you very much, Elena, for your answer. So we've reached the end of the Q&A session. Of course, there was a couple of questions on the roadmap, but they are actually directed toward this our living lab approach, which resonates quite a lot of what you just said, Elena. And I mean, and that's going to be the reason why you have to stay with us, because on the third session, some colleagues of roadmap are actually going to present more deeply our living lab. So you may have the answer to your question there. So 10 minutes break now. So, hi again, everyone. We're going to start with our second session on promising technical innovations to reduce antimicrobial use. And as previously, we're going to listen to a few presentations before a Q&A session. So the first presentation is from the AVANT project by Dr. Liam Good, and it's called Non-Antibiotic Control of ETEC in Piglets using phage and polymer strategies.
Hello, everybody. My name is Liam Good. I work at the Royal Veterinary College, and I will speak to you today about our project, non-antibiotic control of ETEC in piglets using phage and polymer strategies. This is part of the H2020 funded project AVANT, and it's work package 2. Here's the work package overview, and we're looking at developing phage and polymers as 2 separate strategies, but both non-antibiotic strategies to control ETEC in piglets. And as many of you will be well aware, ETEC in piglets is a very large area of animal health need where non-antibiotic strategies would be beneficial. So drilling down into the more specific objectives, we aim for both strategies to determine the potency and spectrum of activity. That's very much in vitro work, develop the safety information package, assess the clinical efficacy and safety in piglets, and then assess the target specificity in vivo with microbiome analysis following the in vivo efficacy studies. This is quite ambitious objectives, especially given that they're 2 different strategies, but we've got a good team working well together. People at the University of Copenhagen, the Royal Veterinary College in London, SFR in the Netherlands, Easy Agricare in Denmark, and Vet in Germany. So let's look first at the phage approach. Most of you will be aware that phage are effectively bacterial viruses, and they can work quite aggressively, really, by destroying the bacteria by specific species recognition and then lysis of the bacteria. What the team in Copenhagen is then doing is looking at the pathogens that cause the diarrhea in piglets, the ETEC strains, and isolating phage and learning how to propagate them and grow them up, effectively manufacture them in a way that they can be used in an animal study. So there's a lot of early stage microbiology involved and a lot of development involved in scaling up the production of the phage and getting high titers of the phage, which you can score in vitro, but they need to be high titers in order to have an effect in the animals. So far, the results in vitro are indicating a growth effect against the target bacteria. It's modest at the moment in liquid, but the team is working to amplify the phage, get higher titer, and improve the growth effect. Parallel to that, in order for this approach to work, you really need to be able to quantify the number of phages and quantify them, not just in sort of clean microbiology media, but also in feces and perhaps in gut content. And so to do that, they're working out methods, which are molecular methods, as you would probably guess, which can be applied in those different matrices. And if you're interested in the details of that, it's been published here. Soon, the team hopes to be putting the phage into animals and testing the effect on diarrhea. So now let's look at the polymer approach, which is the other strategy against the same disease. And again, it's a fairly natural strategy in the way that the polymer we're using is obviously a purified chemical, but chitosan is derived from chitin. Chitin is the second most abundant polymer in nature after cellulose, and chitosan is widely present in fungi and shellfish and the cell walls of many different cells. So we're using a fairly natural polymer here. And then if you look through the literature, you find many reports where chitosan has been used to look at control of diarrhea and promotion of pig health. And so here's a forest plot, and you can see that most of the studies are indicating an advantage. We've looked quite deeply at these, looking at the effect on growth and diarrhea. And from that, we've decided to look at further at a particular chitosan called chitosan oligosaccharide, which is a short version, small molecular weight. And that's based on the sort of positive results from the meta-analysis, also the easier chemical analysis of the shorter molecule, and then that we can access a GMP feed grade. And as you would imagine, we are busy with the microbiology and the chemical analysis, and that will all happen ahead of animal studies, which we hope to initiate this summer. Here's a quick view at the setup of the animal studies, and the two key points I wanted to make was to give you an idea of the percent in the feed, which is quite low, but the forest plot indicates that will be sufficient for an effect. And then these are the zootechnical parameters with a very close look at the efficiency, and then also the spontaneous diarrhea level. We did run into somewhat of a surprise early stage in this project, where we had anticipated to see quite strong or potent antimicrobial effects against the ETEC strains when looking at the cost based on the meta-analysis. But in fact, we didn't. But nevertheless, the benefit seems to be there. So we've developed two alternative hypotheses, which is less antimicrobial as mechanisms, and rather we're thinking that the chitosan is flocculating the cells, or perhaps interfering with the bacterial adhesion to the intestinal cell walls. And these are being tested as hypotheses. Either of them would explain the benefit that's observed in vivo. So to support the studies, both the phage and the polymer, the animal models are being developed, both the growth assays and the challenge models. The growth development models are being run in the Netherlands, and the ETEC infection model is being developed and run in Copenhagen. Lots of acknowledgements here. It's a challenging project in many ways, and very exciting. Just to remind you, the teams that are involved in this work package are in the Netherlands, SFR, University of Copenhagen, Klifavet in Germany, Easy Agrocare in Denmark, and then the Royal Veterinary College in London, where I work. Thank you very much for your attention. I look forward to questions and follow-on discussions. Thank you.
Thanks a lot. We're gonna now move straight away to a presentation from the Healthy Livestock project by Dr. Ingrid de Jong, called "Does the peri-hatching environment affect broiler chicken resilience?"
Welcome at this presentation of an experiment which has been part of the European Healthy Livestock project. My presentation is about the effect of the peri-hatching environment on broiler chicken resilience. Broiler chickens are exposed to various stressors post-hatch. For example, feed and water deprivation, handling, for example for sexing, sorting and vaccination. They are subjected to transport to the broiler farm, to continuous darkness and to continuous noise. To overcome these stressors, alternative hatching systems have been developed. Examples of these systems are on-farm hatching, where eggs are placed in the broiler farm at day 18 of incubation, and chickens can immediately access feed and water and are not transported to the broiler farm. The other alternative is hatchery feeding, where chickens receive feed and water in the hatchery, but are transported thereafter to the broiler farm. The aim of our experiment was to determine whether alternative broiler hatching systems, on-farm hatching and hatchery feeding, improve welfare, health and performance as compared to conventional hatching systems for broiler chickens. The ultimate aim is to determine whether resilience is improved when broiler chickens are hatched in alternative hatching systems that expose them to less stressors as compared to conventional hatching systems. And the final aim is to determine whether this improved resilience leads to better health and thus reduced antibiotics usage. In our experiment, we used eggs of young parent flock between 28 and 31 weeks of age, as these chickens would benefit more from early feeding. We used Ross 308 broiler chickens as hatched, so males and females. And we included the 3 hatching treatments as previously described. On-farm hatching, where eggs were transported to the broiler farm, chicks hatched at the broiler farm and could immediately access feed and water. Hatchery feeding, where chickens received feed and water in the hatchery immediately post-hatch and were transported to the farm. Or conventional hatching or hatchery hatched, where chickens were transported to the broiler farm and did receive their first feeding there. The experiment was carried out at the Experimental Poultry Center in Geel in Belgium. We had 3 consecutive production cycles included, with 6 rooms per batch with 2 pens each. Each treatment was represented in 4 pens per batch, and in total we had 12 pens per treatment. In each pen we had approximately 1,100 chickens. During the course of the experiments, we measured day-old chicken quality, such as navel and hock quality, the length, the body weight of the day-old chickens, yolk-free body mass and organ weight. We measured the performance, feed intake, body weight development, water consumption and mortality on a daily basis. We determined the welfare by measuring footpad dermatitis, hock burn, cleanliness, gait score and also the behavior. We determined the slaughter yield and also meat quality aspects. I will present some highlights of the results. Regarding day-old chick quality, as you can see in this table, the hatchery hatched chickens were less heavy as compared to the hatchery fed and the on-farm hatched chickens at day 0. On-farm hatched and hatchery fed chickens were also longer, so indicating a better development post-hatch. With respect to the navel condition, we found that on-farm hatched chickens had a worse navel condition, but also more red hocks as compared to the other treatments, indicating a worse day-old chicken quality. When we look at the body weight development during the course of the experiment, we observed that hatchery fed and on-farm hatched chickens were heavier until the end of the experiment at day 39, which was slaughter age. In the beginning of the experiment, on-farm hatched chickens were also heavier as compared to hatchery fed chickens, but this difference disappeared during the course of the experiment. We did not find any difference in mortality, nor in total mortality or in first week mortality. We also determined carcass yield and meat quality aspects. Hatchery fed and on-farm hatched chickens had heavier carcass weights, but no other differences were found in carcass yield. With respect to meat quality aspects, we found significant differences. We found more wooden breast, which is shown in this graph for the wooden breast scores, in hatchery fed and on-farm hatched chickens, and we also found a higher prevalence of white striation. So, they were heavier at slaughter, but had more wooden breast and white striation as compared to conventionally hatched chickens. With respect to welfare, we only found a difference in footpad dermatitis scores at slaughter age. This graph shows the footpad dermatitis scores at day 21, which are the first 3 bars per score, and day 35, which was close to slaughter age. These are the final 3 bars for each score. On the x-axis you see the score from 0 to 4, an increasing score meaning more footpad dermatitis. What you can see in this graph is that on-farm hatched chickens and hatchery fed chickens had more birds with a score 0, meaning they had more birds without any footpad lesions. Whereas conventionally hatched chickens, so the hatchery hatched chickens, had more birds with a score 3, meaning severe footpad lesions. So on-farm hatching and hatchery feeding led to less footpad dermatitis as compared to conventional hatching. But no other differences in welfare indicators and behavior were found. In conclusion, on-farm hatching and hatchery feeding improved chick quality and development of young parent chickens of young parent flocks. A worse navel quality was found in on-farm hatched chickens, but this did not affect mortality or performance. On-farm hatching and hatchery feeding resulted in better growth performance, but more breast myopathies. There was a limited effect on welfare, but on-farm hatching and hatchery feeding resulted in less footpad dermatitis. So, to conclude, alternative hatching systems may have benefits for performance and welfare. And the effect of these hatching systems on resilience to disease is being tested in a follow-up experiment where we subjected the chickens to an IBV challenge. Thank you very much for your attention, and I would like to acknowledge my co-authors, which are listed here. And I would like to refer you to the both publications, of which the link is included in this presentation, that describe all the results of the experiment we performed. Thank you very much for your attention, and I would be pleased to answer any questions.
Thank you very much, Ingrid. And we're going to stay with the Healthy Livestock project with a second presentation by Professor Shuming, which is going to be on a case study called Integrated Technology Application of Early Diagnosis and Immunity Improvement in Chicken Farms.
Good morning, everyone. My name is Shuming from Institute of Quality Standard and Testing Technology for Agricultural Products. Thank you for invitation of the conference organizer. I have a chance to report a case study, technology application of immunology improvement in chicken farm. Three years ago, European Union and China initiated an international cooperation research project with the aim to reduce the use of the antibiotics residue and drug-resistant by comprehension technique. This project focuses on the 4 key techniques for biosecurity, where prevent pathogen intrusion, animal welfare, or some additives will improve the animal residence. Early detection will find the animal in early period of disease. Antibiotic alternative or antibiotics precision medication where can reduce the use of the antibiotics. After the 4 key techniques will be developed, they will be validated in the pilot farm to show whether these techniques are possibility in the practical production. So a farmer with about 40,000 broiler will be chosen as for demonstration. This farm is located in Shandong province, and also this is use the routine management, and that is a typical Chinese broiler farm. $4,000 broiler were divided in the 4 groups for the control, for the 2 additive for the probiotics, for the betailing, and the mixture of the premix and betailing. So the result show for the for the body weight or the gain weight, you will find for the biotics or betailing where can little bit improved compared to control. For mixed, they can significantly improve the gain weight. When we look at for the chicken intestine, they were found for the low or high concentration of probiotics, they can promote developing of the testing villi and the upper regulator expressor of the high junction protein in the epithelial cells. When we look at for the venous height or the cypro depth, they also were found will be improved by probiotics compared to control and all other additives. For the end products, the dragon residue were also reduced for the following 5 antibiotics: for the tetracycline, for the tiamycin, for the tyrosine, for the ampicillin will be significantly reduced compared to the control. When we use the NDS scrubber, we get the sample to show for the antibiotic resistance for the E. coli will also be improved compared to the control, especially for the aflatoxin, for the chlorantholicol, for the dicycline. Then we move to the early detection. The technique of estimation for the broiler behavior has been tested also in this pilot farm through the thermometer, illuminator, or the infrared or some other device. Then you use the infrared image. We can make with the help of the mathematics, we can recognize the chicken with the leg disease. Then we can get the ROM index. Then to show this chicken with the leg abnormal, then we can take this chicken to the group. Also, we can use the broiler respiratory tract voice acquisition device. Then we can find the chicken with the problem for the respiratory disease. Then we can take this chicken also from the group. Now we move to the antibiotics alternative. As you know, some Chinese herbs have a function for the disease. For example, for the Fangfeng and the Fangji, they have function for the infection synovitices. For the Changshan, they have a function to kill coccidiosis. So then this herbal extract will be produced with license for the marketing. Then you will find a series of this herbal extraction has been used for as the beginning, in the middle, or in the end of the broiler. The result to show the herbal extract group have the same protection ability as the antibiotics, but the drug cost has been reduced a little bit, and the drug use will significantly be reduced. Same things for the antibiotic resistance. Now we can come to the conclusion. The demonstration in pilot farm implies that probiotics early detection and herbal extraction can improve the animal performance, drug residue, and antibiotic resistance in practical chicken farm. Unfortunately, we can answer your questions face to face. You can use the email to send your questions. My colleague and I are happy to answer any of your questions. Thank you.
And just before we launch the last video, I just would like to remind all the attendees that don't hesitate to put your questions in the chat box or in the Q&A box. I will manage them after. And this last presentation from the DISARM project, this time on dissemination material, database, videos, abstract, and best practice guides and toolbox by Dr. Laura Balczynski.
Hello, I hope you are all enjoying the conference so far. I'm now going to give a quick presentation about the key dissemination outputs from the DISARM project. Our key focus is on working together to promote strategies for improved livestock health and the reduction of antimicrobial resistance. DISARM is a thematic network project, which means we aim to connect different types of actors to share their knowledge and experiences. In this way, we can share cost-effective and beneficial strategies which can improve animal health and reduce antibiotic treatments. For example, through good housing management and biosecurity, nutrition, and use of technology. For example, using precision livestock tools for earlier and more accurate diagnoses can allow quicker and more successful treatment interventions. We love to hear from farmers what has or hasn't worked on their farm and what they would recommend to others. We're also interested in industry innovations and effective products, as well as research with promising practical results which can be used on farms. By improving animal health and reducing the need for antibiotics, we can reduce the selection pressure that drives the development of antibiotic resistance. We promote the idea that antibiotics should be used as little as possible, but as much as necessary to treat disease and protect animal health and welfare. Based on our 3 core activities in DISARM, which are developing a database of existing information from research, industry, and farming, our multi-actor farm health plans, which Annick will speak about in detail in the next session, and our community of practice, which is an online discussion forum where people can exchange ideas and information. From these inputs, we are producing practical, user-friendly information resources. Those materials can be found on our website, www.disarmproject.eu, along with more information about the DISARM project and options to contact us or subscribe to our newsletter to keep up to date with our activities. We have an easy search function which enables users to search all of our resources or look within a specific category. We focus on a range of strategies to promote good animal health and responsible antibiotic usage in beef, dairy cattle, pig, broiler, and sheep sectors. Here you can see the different topics we cover. The community of practice voted for our main focus to be on biosecurity, both internal and external, vaccination, breeding for resilience, housing and group management, including in extensive systems, nutrition, water quality, precision livestock technologies, and prudent use of antibiotics. We are in the process of adding more than 500 summaries of innovations, tools, and checklists which we found from research, industry, and farms to the website. Those include links to the original source material, and later this year, a report offering an overview and key insights will be published. We are also creating 100 short videos. Those that are already completed can be viewed on our website or by visiting the DISARM project's YouTube page. These videos are complemented by short summary text highlighting the key points from the film. There are different formats for these. Some are a walkthrough of, say, a hygiene lock on farms. Others are testimonials from farmers. For example, this one from a dairy farmer in the UK.
We've made a number of changes for antibiotic use over the last few years. We've gone from using a lot of critically important ones, cut those out completely now, and we've also gone from dry cow therapy on every cow to selective dry cow therapy. So antibiotic use, big changes. We're now doing a lot more vaccinating too to stop us having to treat for pneumonia and things like that. It's interesting with the mastitis cases, we milk record every month, so we always know the high cell count cows. We know what our tank cell count is, which is running at about 100 at the moment. So it's not really a case of treating every cow for mastitis. We get to know the cows that have always got clots in. We get to know the cows that are a problem as well, so whether we decide to cull them out of the system by having all that detail. But if it's ones with clots that we think will clear up, then we do use Udamint, we do use Metacam, to anti-inflammatories to make sure we can help on that basis for the cow, and we won't necessarily go straight to antibiotics to try and cure the cow. The advantage is that we only have two people who milk the cows here, so between them they know the cows, and that makes a big difference too. And making sure that you've marked up any cows that you are treating, and with our parlour software, it does shout at you to tell you there's a warning on that cow, so at least then you can also use the software to help as another aid as to why you should or shouldn't treat that cow. But don't necessarily go straight. If they've got some clots in one quarter and we think we can clear it up, or it's a perpetual one that at the moment she might go on the cull list rather than actually treated with antibiotics all the time.
We are also developing best practice guides, one for each of our 10 focal topics. These will be made available in 8 European languages later in 2021. In addition, if you are interested to set up your own farm health team, we are developing a toolbox which outlines the process and provides useful hints, tips and tools for getting started. We're still building this at the moment, but for now there is a brilliant webinar from Lisa Morgans about facilitating change in small groups. I really recommend that recording. Of course, it's not enough to create attractive information materials. We have to spread the word about them. To do this, we use events and workshops, mostly digital lately due to COVID-19 restrictions. The good thing about digital events is that they're good opportunities to reach a wider global audience without the need to travel, so that reduces the time commitment for attendance. But hopefully we can soon be able to get back to doing more local face-to-face activities again, because particularly with smaller groups, these can be more impactful because of that personal element. We also promote our resources and upcoming events in our newsletter, on our website and via our social media channels. Look us up and subscribe to our newsletter or follow us on social media to keep up to date with our activities. And if you have some useful insights or practical information that you want to share with us and our network, please get in touch. We'd love to hear from you. And our community of practice is available to join on Facebook. Simply answer the registration questions and our administrators can let you have access to the group. Thank you for listening and enjoy the rest of the conference.
Well, thanks a lot to our 4 speakers for this pre-recorded video. Now we're going to have like a Q&A session for about 20 minutes. So I will start with possibly quick questions, but maybe not. I think I have something for Ingrid. I mean, someone are asking, what is the effect of on-farm hatching on biosecurity?
Yeah. That's a good question. Of course, when you have on-farm hatching, you have to some systems remove the eggshells, and you have to remove the unhatched eggs, and that may have issues with biosecurity. I'm not a specialist, but in general, I have not heard of any problems related to the fact that eggshells may remain in the house, for example. So generally, from practice, the opposite is said, that when farmers use on-farm hatching, their flocks seems to be, more less sensible to get a disease. So.
Thank you very much. And a quick question as well for our Professor Young. Which probiotic did you use in your studies? That has been asked.
Sorry, Nicholas.
Yeah.
Signal is not good, so please say it again.
Yeah, you've been asked what probiotic did you use in your study? Which is the probiotic that you have used? I'm gonna write it.
You mean which pro mix which will be used in my study?
Yes.
Okay, so that is some commercial, antibiotic, probiotics. So that is, that's a domestic products. They contain some the live bacteria. So then anyhow is a commercial one. Okay.
Okay. And you also have a second question on the way basically the protocols or your studies have been implemented. I mean, have you tested all of that only on small scale farms, or also in more large commercial settings with large groups of broilers?
So that's is just a practical farmer we use it, because we before we do this study. So now some this product has been studied in some small farm. Anyhow, now we just want to show the result, to validate the result in the very big practical farm. So that's it.
Okay, thank you very much. And Liam, I mean, someone we're wondering, like, this phage approach. I mean, do you perceive it only as something like a curative or therapeutic, or is it some kind of tools or medicines, if ever you call that medicine, that could be used in more preventive also approach, or possibly metaphylactic? I don't know. I mean, the types of approach that could be embedded somehow with this innovation.
Yeah, so we are looking first to establish the efficacy of it in the animals, and then we'd be thinking about it one of two ways: either as a feed additive, maybe registered that way, if it's there might be possibilities for that. If not, then it would be a medicinal feed additive, but one way or another in the feed. Yeah, and it could well be used. We think it has merit as a way to prevent it and lower down the total amount of the ETEC bacteria.
Mm-hmm. Thanks a lot. And Laura, we have a newcomers. Well, we'll see what's happening. But how do you basically measure the implementation of the various strategies that you've been presenting?
Yeah, that's a challenging thing in terms of we're obviously putting on videos, digital strategies to try and reach people, but how do we tell whether people are actually implementing these at the end is a challenge, and I think it's a challenge for other EU projects as well. We are, and Annie, who just appeared just now, will be talking more about our farm health plans, which is more, there are case studies with farmers doing action plans with their advisors, so that we then get a bit more feedback on what they've done and how they found it.
Mm. And do you know actually who is using the material that you have on your web platform, or that you distribute in some way? Can you track on that? And yeah, do you have feedback? Do you have feedback by the potential users of these materials?
Yeah, so a good indication of that is from our community of practice. It's easy to see the types of people who've signed up to that. Obviously, the other sources are a little bit more anonymous, but on the community of practice, primarily it is researchers and veterinarians who we hope will then disseminate it as well. But we do have a fair number of farmers on there as well.
Mm-hmm. Thank you very much. Maybe coming back to AVANT and healthy livestock, like more in general, but if we look at your presentations, I mean, you of course you are not only working on a health approach or therapeutics approach. You all link animal health and therefore the use of antimicrobials to other dimensions basically of farming, such as you've been mentioning resilience, biosecurity, animal welfare, and things like that. So basically I'd have a general question for the three of you, and possibly as well from Laura. Maybe you have also feedback from the people you're working with, but how conceptually, I mean, how important is it basically to conceive like holistically, basically what is happening on the life of an animal, and including possibly the relationship with the farmer, to actually be able to have an impact or an effect on how health is managed, and therefore antimicrobials or other products can be used. I mean, I really had the impression that like some of your research are really focusing on different compartment or elements of the animal than just animal health, and I really would like to have your view on how important it is to basically get out from a too narrow approach of what is health and how it is connected to other dimensions. So I don't know who want to start. I mean, but yeah.
Well, I can say something about that. Thanks, Nicholas. It's a good question. It's as you know, when you're running these projects, it's hard to satisfy all of the objectives that you're after. But one of the ones that we've tried to emphasize in AVANT, I think, is to sort of start with the farmer and the problem of the farmer, and kind of, if you like, reverse engineer some of the implementation, so that if it's successful, then the farmers will be happy with it, and the ethics will be good, and the regulatory authorities will be happy. So I think that's maybe something that we've tried to do, is start at the end, basically work backwards to the intervention. So maybe, I think sometimes they call that a pull rather than a push. So rather than so much push the technology that we have, that we is our sort of pet, we've tried to sort of start from the other side. Yeah, and I mean, it's a work in progress, but I think that for me, that has been a little bit of a change within the event, and it's been interesting to be part of that.
Thanks a lot. Yeah, Ingrid, sure.
Yeah, it's indeed a good question, and I agree with that you cannot do all. But in the Healthy Livestock project, there are different approaches. So we are only working on the whether we can increase resilience by improving the perinatal environment of broiler chickens, but Healthy Livestock also focuses on biosecurity, on alternatives to antimicrobials, and also using technology to give early warnings in case the chickens or pigs show a change which can be related to disease. So it's always a kind of a combination of the different approaches where you can improve the health and reduce the antibiotic usage of the animals. So it's not only a single thing. If you apply on-farm hatching, of course the birds can still become ill in a later stage. But by combining all the different things, you hope that you will in the end improve, decrease the risk to use antimicrobials. Yeah.
Thank you. Yang, do you have anything to add to that?
Okay, so I just have a question for Ingrid. So you mentioned, for you found a better, hatchery, just on farmer hatchery that is better, can improve the animal behavior or something like that. I wonder, whether it's a success or it cost is too much than, hatchery. or this works for practice? Just in Holland or in Europe?
Yeah, can I answer the question?
Sure, yeah, please, of course.
Yes, yeah, on-farm hatching is actually applied on an increasing number of farms. It started, I think, mainly in our country, but it expands to other European countries. And of course, it asks more from the farmer in terms of management, because you have to also pay attention to the hatching phase. But the farmers that are applying on-farm hatching say that they have benefits in terms of improved animal health and improved performance. So at the end, the fact that you have to increase the environmental temperature because the eggs need to hatch, and you have to pay, you have more labor around the time of hatching. It also has advantages in terms of maybe less rejections, healthier birds, and better growth. So that's why I think there are quite a couple of farmers that already applying it for several years, and I think the number is gradually increasing.
So okay, you mean so now is just the beginning, for the on-farm hatchery, compare for the conventional one. You mean what that?
Sorry, I missed the question.
You mean the on-farm hatchery is just the beginning for the practical production. For
Oh no, it's already applied at. It's not in the early stage. It's already applied at quite a number of farms, and there are different systems for on-farm hatching. So more automated and more, simple systems where you just place boxes. If I understand the question correctly, yeah.
Thank you.
Yes, thank you.
And Laura, do you think that, I mean, the things that we've been discussing here, like this variety and what I will call holistic approach, of this issue. I don't know if this is the right term, but I guess you guess what I mean. Is it something that on the field, I mean, and Ingrid has already talking about some farmers that are more or less implementing that, but I believe that in the DISARM project, you have a large variety of examples and experiences among many countries and sectors. So what is your feeling about that? Do you think like farmers and advisors, that this is how they perceive now the issue, and that it is absolutely essential to be able to reduce antimicrobial use or foster prudent use? And how possibly is this feeling or vision distributed, between countries, possibly sectors, possibly production systems? I don't know, but since you in DISARM, you may have like a large vision of the variety of farming practices. Maybe that would be interesting to have your view on that.
Yeah, I think that's a good point. And obviously, if we're researching and doing projects on antimicrobial resistance and reducing antibiotic use and focusing on animal health, then that's going to be our passion. That's what we're focusing on. Those are the kind of criteria that we're measuring. However, a farmer has to also consider their economic impact, their environmental impact. So many different things affect them in their real world. So part of the recommendation for these multi-actor farm health teams is that it doesn't necessarily just have to be focused on health and nutrition with your vet, your nutritionist, the farmer. You could also bring in your financial advisor as well, if you were talking about investing in new facilities, for example. And it's really important to get those different perspectives as well, because as Ingrid was just saying, on-farm hatching, you also have to increase the temperature in the shed for that. So does that then have run-ons in terms of your carbon footprint and things like that? So it's really important to not just think about the health as a holistic thing. It's a whole farm thing, and wider than that as well.
Yeah, thank you very much. And if we don't have any more questions, I'm checking, but it doesn't seem that could be actually a very powerful conclusive word for this session. I know we have 5 minutes ahead, but maybe Nathan, can we call the break already? And maybe we'll have 5 minutes more. And so we see us again, exactly in 15 minutes at 12:15 for the last session. So have a nice break, everyone. And thanks again for our 4 speakers, of course. Thank you very much. Hello again. again, everyone, and welcome back for the last session of the last theme of our morning session about antimicrobial use in livestock. So we are going to talk now about stakeholder engagement and impact, which is also a very important topic for all of our 4 projects, because of course everything we do it for fostering change, basically. So we also have to take into account those dimensions heavily to make our projects works. So we welcome our 3 last speakers, Annick Spans, Bernadette Ewen, and Mette Varst. So we're going to start with first presentation from Bernadette and Mette from the Roadmap project about experiences with living labs as an approach towards prudent antimicrobial use in different contexts.
So now Bernadette Owen and I would like to present some experiences with living labs as an approach towards prudent antimicrobial usage in different contexts in the project roadmap. First, I'll give some highlights and conclusions. Living labs offer a special way of working across stakeholders. It's a multi-stakeholder approach. So working across stakeholders to solve a problem and find new solutions. It's based on dialogue and doing something. So it's not just about talking, it's about experimenting and actually acting together. The living lab has a learning cycle approach to reach its goals, and it's absolutely paramount to acknowledge the diversity and the importance of the context. We have to think about when we want to change the antimicrobial usage, we need rethinking, but we need not only to innovate, but also to break down practices and so on. So it's both about breaking down and building up practices, alliances, and expectations. Our research approach in the roadmap is that we learn in the living labs and we learn about the living labs in this special context of European animal farming. So in this presentation, we're going to give an introduction to the project roadmap, an introduction to the living labs and what is special for the living labs working for prudent antimicrobial usage. We are going to talk about the actual experience in roadmap about our living labs. We are going to talk about how living labs need to create a common vision. And we are talking about focus areas and methods in the different living labs. And then we are giving highlights and conclusions again. To just give an introduction to roadmap and its aims is that antimicrobial usage or antimicrobial resistance is recognized as a significant global threat for public health and for food security. And overuse and improper use of antimicrobials contribute to this. 2/3 of future antimicrobial usage growth is estimated to happen in animal production. So what we want to do in roadmap is to foster transition towards prudent use of antimicrobials in animal production in different contexts to manage antimicrobial resistance. This we want to do by enhance antimicrobial decision systems and we also focus very much on animal health and welfare support in the roadmap project. When looking about how have we previously approached antimicrobial resistance and supporting animal health and welfare, we have very many participatory approaches to improve farming practices. And here are just a list of examples that we have reviewed as a part of roadmap. But what makes the living lab approach distinct to compared to those previous approaches is that here we take a multi-stakeholder approach. So we go across the whole sector and go beyond the farm level. And we co-create this throughout a process with certain steps. We are commonly identifying the problem, the focus, and the visions. We are sharing ideas and solutions. We are planning action together. We are implementing it together. We are testing it and sharing and discussing and evaluating the results. And we take commonly ownership. And that is based on the participating stakeholders' needs and wishes. So the participants in the living labs are stakeholders and represent organizations and larger groups. And this is a balance between mutual trust and representativity among these stakeholders. And it's a lab. It tests technical solutions, social solutions, communication and strategies, and the living lab is meeting around the results. It's a dynamic process, and this illustration is illustrating in various ways how this process can be thought of. It's taken from literature about how living labs have been working in different contexts. But how are living labs then special in roadmap? What makes them relevant to work with for prudent use of antibiotics? We are working with different stakeholders: farmers, farm-related actors, veterinarians, agriculture, food industry, all the actors and stakeholders that are core to the changes throughout the sector are part of a living lab. They are brought together here to actually find solutions. So it's context specific. We commonly identify problem, we negotiate about, we understand it, and we agree on it in each living lab. And we see already now, based on the roadmap project, multiple versions of optimal mix of stakeholders that have to fit to the diverse context in different countries. All stakeholder participants are commonly defining the focus and planning the action in the lab and implementing it and evaluating it. And they may have different interests and stake. So it's not only about innovation. And that is very important to think of, because that makes it distinct in this context of animal farming compared to many industry approaches to living lab. It's not only about innovation, but it's also about breaking down previous routines, attitudes, alliances, and so on. And this process is so important because there is so much at stake for many stakeholders. And one of the tools to do this is to create a common vision and to agree on what is the common problem, to help changing these potential conflicts of interest to commonality of interest. And this illustrates, here we have two photos of an exercise in a living lab where different stakeholders are sharing their visions and discussing where are our common visions, what do we actually want to see as an outcome of all this.
Thank you, Mette, for this introduction into our living lab approach. I will now continue with our first lessons learned and conclusions, and this is based on 1 year experiences with living labs in Roadmap. Since June 2020, 12 living labs have been established in different countries in Europe, and they are connected to 3 different livestock species. It's cattle, it's pig, and it's poultry. In some living labs, several meetings have already took place. Others still have their first meeting to come. The main aim of all living labs is a prudent use of antimicrobials. But however, this overall aim is then adapted to the different contexts and situations. And how this is translated into an activity, I will come back later to that. We try to involve different actors into living labs, actors that are relevant for the individual supply chains. And this is mainly achieved in roadmap living labs, not in all the cases. Also here, I will give you further information later on. We are convinced that living labs would work, even if that approach were new to all of us. And in a way, we convinced all the partners in Roadmap, and we were all interested to find out how this implementation, this more than talking, this joint experimentation would work. And we are surprised that the actors involved in living labs, they were committed to the approach and they really took over ownership of the process. However, they still needed guidance, and this guidance is still needed. So we offer all the partners involved in living labs and involved in the living lab approach, we offer them opportunities to exchange, to learn about their individual living labs, but also to learn about living labs. And this process will go on until the end of roadmap. We planned for 4 living lab meetings during roadmap, so that would be the minimum. But we have learned that's not only the meetings that needs to be prepared, it's also the time between the different meetings, and that the drive needs to be kept during these meetings. So what we developed for that is that the facilitators could remain in contact with all the individuals or groups of living labs, or that specific groups are created and they are working on a part of the strategy developed. Or we offer them international exchange. So that's something that really motivates people and keeps them in living labs. Here, some examples what we've developed in the roadmap living labs so far. We are mainly addressing 3 levels: the farm level, the sector level, and the structural level. At farm level, we see activities connected to learning, and these activities do not involve exclusively farmers. They are also meant to train and offer learning opportunities to vets. At the sector level, it's mainly creating awareness in the whole sector. For example, for the case of dairy calves and the investment in their health that should be made at the farm where they are born. In some cases, it's the legal context that's challenging and probably not properly implemented. Also, this is an approach used in one of the living labs. So what are our conclusions? So first is we had to explain what living labs are. So, and this is at the beginning a very relevant step, that people know what living labs are. Currently there's a lack of experiences, so learning about living labs is also relevant. But what's also relevant, trusting the process. Be convinced that the process that involves people, that this is something that will work. What we see is that a challenging thing remains in the food sector, that we have in some cases European-wide supply chains. In Switzerland, we have the advantage that our whole supply chain is based in Switzerland and all the actors are here in Switzerland. The turkey sector in the Netherlands is different, and the turkey fattening is just one step that takes place in the Netherlands, and the rest of the supply chain is situated in Germany. So it's challenging to involve the whole sector into a living lab if the sector is out of the sphere of influence of the people who are managing the living lab. We see situations where there's a strong competition between the actors in the supply chain. Also here, living labs are challenging. We see in some cases it's one powerful actor that vertically integrated several steps of the supply chain, and no change is feasible without the commitment of these one powerful actors. So even if there are challenges, we see that Living Lab offers special ways of working across stakeholders and to solve a problem and to really come up with new solutions, and solutions that are then based on a commitment of a sector. The Living Labs are based on a dialogue and doing something in parallel. It's not just talking, it's experimenting, it's evaluating. So Living Lab are something that we see is a new approach, and it's challenging even if some and new to all of us. So we have to learn in the living labs, but in parallel we have also to learn about living labs in the specific context of European animal farming. So thanks for your attention, and looking forward to hear from your experiences in living labs.
Thank you very much for this clear presentation, Mathieu and Bernadette. And just before we go with the last presentation, I remind you once again and one last time to put your questions in the chat box or in the Q&A tool of the platform. And after the second presentation, I will review the questions basically and host the Q&A session. So now we're going to listen to the last presentation of this morning from the DISARM project by Annick Spans, which is called Improving Antibiotic Use Through Multi-Actor Farm Health Plans and Coaching. Well, sorry, it seems that we have a little technical issues. It's gonna be sorted out, I guess, very, very soon. I'll let our technician here to try to deal with that, to check whether we're all good. So waiting for the technical issue to be solved, I suggest we can possibly start with a couple of little questions for the presentation of Mette and Bernadette, the roadmap project. Yeah, I can see your comment in the chat box. Yeah, we've noticed that there is this issue. I don't know if Nathan, you can put maybe the speakers as well, so that we can chat all together a little bit, so, because it seems that it's only me right now. And I will not answer the question myself. Okay, I see it now. At least Bernadette is with us. That's wonderful. And yeah, it seems that. Okay, so no, but I was wondering, one thing that I was wondering, Mathieu and Bernadette, I mean, even if obviously I know a little bit of what you're doing, but it was regarding then when you were presenting the various levels, basically, of what is happening at the living labs, or the farm level, the more institutional level, and that the fact that the different living labs in the project may try to approach different types of actors and things like that. So how do you see that we're going to manage the connection basically between those levels, you know, like when we have living labs that looks like stable schools, basically, with vets, advisors, and farmers, obviously we are able to co-construct solutions and to have discussions among these types of actors who are what we call usually the end users. But then we also have sometimes in the same living labs, but in other meetings, but sometimes in other living labs, more institutional actors, representatives of industry or cooperatives, or even sometimes the government. So basically the types of discussion, the types sometimes as well as of solutions, or the way of implementing the solutions are, I mean, this could be quite different. So, and that is a major challenge for every project actually that have been presented this morning, like basically how the research that we are doing could be implemented at the various level, you know, at the farm level, the food chain level, and maybe then the institutional level. So how do you see that those participatory tools being able to create impact? I mean, yes, you've been talking about that, but to be able to have multi-level impact. And of course, Annick, you can also, even if I really hope that we're going to be able to listen to your presentation in a couple of minutes, but I'm pretty sure that this is also a question that you have in the DISARM project. So I'd be happy to hear you on that too, actually.
Yeah, well, if I should start answering, there are very few living labs that take all levels into account, of course. I mean, because, and I think that is where the importance of the context comes in. It's very important that for every situation, for the sector, two sectors in the same country may be in a different situation. So they will need a different approach. And it is an interaction between what the project team in Roadmap have set out to start doing. They kind of make an initial frame, but then after that, the living lab itself sets a focus too. So for some living labs, I mean, I can mention one of the Danish living labs as an example. I mean, there are like more levels targeted, but the focus is chosen by the living lab. And I think that the collection of living labs in very many different contexts will altogether bring a picture together where we can see how stakeholders work at different levels with different aims. And but some of the tools, I mean, for the dialogues in the living labs, they are like quite similar over different living labs also. The focus is different.
Thank you. Anyone would like to comment on that or to add anything?
Just in brief, I think this is a process that happens in parallel to some of the living labs who work very, let's say, specifically on one topic or one domain or one sector. So they have an awareness that themselves alone probably they cannot change something. They need also other aspects to take into account. And in some cases, this is also kind of an outcome of these living labs, that they start with a next step involving additional actors. That's the process some of the living labs go through. And I think that's very interesting to observe.
And I think also that over time, I mean, one thing is how much is different levels are targeted at the same time. But I mean, it's also a process. When you start with one level, you may see that there is some legislation that is, or some brands or some marketing issues that needs to be targeted. So the next round, so to speak, involves other levels, and the living labs can be open to involve new member stakeholders and so on. So it's like a rolling process. We are only in Roadmap, we are only following it over a couple of years. And so, but I mean, I could think of a living lab just rolling with different approaches and different like stakeholders involved over a period of time.
Yeah, thank you very much. Yeah, of course, that would make sense. Annick, do you want to comment on that, or should we watch your video, since apparently the technical issue are sorted out?
Yes, I suggest to move on to my video. I think that's the main difference between Roadmap and DISARM, that we are really more focusing on farm level, whereas Roadmap is more looking at different levels. But that's also what I will elaborate on it during my presentation.
Okay. So let's listen to you, to the pre-recorded you, and then move back to the discussion.
Hello everyone, my name is Annick Spaans. I'm working from the Netherlands, working for the ZLTO, a farmers association, and I'm involved in the DISARM project, mainly with communication activities, as well as the practical implementation of the project in the field, which is about farm animal health teams for healthy livestock farming and prudent use of antibiotics. And we are using over there a multi-actor farm health approach, and I will tell you something more about this to you in the next few minutes. I will start with this picture, as this clearly illustrates the farm-specific action plan we are working with. In this picture you see the farmer, the feed advisor and the veterinarian together at a table with a coach or a facilitator working on a farm-specific action plan. And you see that it is real teamwork and they are working on a specific action plan in order to improve the animal health and the reduction of antimicrobials. You can think about various types of actions. So think about improving the biosecurity, feed management, water quality, changing genetics, and so on. So it's very diverse and very farm specific. But in the end, it's all about teamwork, having the farmer, the feed advisor, and the veterinarian together with the aid of a coach. The coach is guiding the process, while the feed advisor and the veterinarian are giving their knowledge and expertise. And together with the practical knowledge of the farmer is making the final decision about his action plan, and together they are implementing it and striving for a better animal health and a reduction in antimicrobial use. So why we are promoting this approach in DISARM? We believe that reducing the need for antimicrobial use is more than it's just cutting its use, because it's a very complex thing. It requires a knowledge-intensive process and rethinking farm-specific management practices and farm organization. But it's also something in their minds, so we need to break routines and change behavior and change perceptions and presumptions. And that's also why we think that coaching is an essential element in this approach, as coaching helps a team in making changes into the desired direction in a desirable manner, as it brings out the potential to improve performance and to change perception, and it builds awareness. So a coach can help in motivating and their choices and leading to a change. They can guide the people to stimulate to talk and to say whatever they want. Well, in DISARM, we are currently busy with the farm animal health teams for a while, and there are some advantages we are experiencing. We see that different sources of knowledge of the farmer, the veterinarian, and the feed advisor together at one time works very efficient, and there's a synergy in team discussion that has an added value over the individual consultations. You often see, for example, that the farmer has an appointment with the feed advisor and they are pointing to the health issues of the veterinarian, or the other way around. If there's a challenge discussed with the veterinarian, they are pointing to the feed advisor. But by having the team at one place together with a coach, it is seen that it's real teamwork and they are having shared ownership and motivation to actually do something together and start working on their goals in action. So they have support from the other team members, especially for the farmer, in making the change. And the big advantage of having the coach inside the process is that there's a really structured process in a tailor-made action plan. So within DISARM, we have currently 42 farm health teams in Europe, and you can see at the bottom of the slides the different countries and the different sectors we are working with. And with these farm health teams, we are using the input of DISARM. So we are using the community of practice of Facebook, the state of the art, and we are also collecting best practice examples, such as we are making videos, practice abstracts, and we are also organizing events. And that's also very interesting to look at the farm animal health plans itself. So we want to share this approach also to everyone, and we are doing this by giving workshops about the farm health approach, and we are currently developing an online farm health toolbox, and we will also develop video testimonies and case study reports. So if we go a bit more in detail about how the approach actually works, you can see over here an arrow with the plan, do, check, act. And that's the key element of this approach. We always start with the farm intake, so we will have a visit on the farm and have a short interview about the main health challenges, collecting some technical results, and think about the collection of the contacts of the feed advisor and the veterinarian. Then we set our first meeting to set together the diagnosis with the veterinarian, the advisor and the farmer, together with the coach, in order to develop an action plan. So this is the plan phase. And then the responsible persons need to implement the action plan. So that's the do phase. And then after a while, there is a follow-up meeting in which the action will be evaluated. And if needed, there will be a follow-up action. So it could be an adjusted action or a new action. And this cycle continuously follows up. And after a while, we will have the last meeting in which the process will be evaluated. Next to this process, we will also have a knowledge exchange for the farmers, in which they can learn from each other. We will have a national exchange as well as an international exchange. But of course, due to the corona crisis, we still need to see how we can organize it. But of course, we do have digital alternatives. Then, if we look a step more closer, I want to go to the stepwise approach of the Plan, Do, Check, Act circle. I've already showed to you in the previous slide, what we always do is observe and define. And then we start with the inner circle to think about the key element of the challenge they want to reach at the farm. So what's it about? And in DISARM it's quite obvious about reducing the use of antimicrobials. And different themes are related to this. Think about the vaccination protocol, genetics, biosecurity, feed and so on. But you cannot start doing all themes at one time because it will be a chaos and it isn't structured at all. So you need to prioritize the themes and think about what is the most important thing to focus on right now. You need to define the theme and make a goal of it and make it smart. Then we are going to step 2, which reflects again the Plan, Do, Check, Act method, in which in the left part you see the SMART goal again, which stands for specific, measurable, acceptable, realistic and time specific. So that means that if you are creating a goal, all SMART elements needs to be included in it. So it will be a very detailed goal in which, for example, a measurable element is in it, such as a percentage or a number, and it would be very time specific. So within 3 months a certain activity is reached. And of course it will be very detailed. Then you go to the implementation phase, the do phase. So who is doing what and why? And after a while, after the time element of the SMART goal is reached, you're going to evaluate it. And you can see who is the project owner and who is the project solver, as it can differ. The project owner can be the farmer, while the employee needs to execute it, for example. And while evaluating it, you can see that sometimes a goal needs to be adjusted or a follow-up goal is coming from it. And that's the act phase. So if you have adjusted your goal, you have already a new SMART goal and then the cycle starts again. So in that way, you are continuously busy with the Plan, Do, Check, Act circles, improving your goal in order to come closer to your final goal of the reduction of your antimicrobial use. So here you see a bit more in detail the definitions of the SMART goal, so specific, measurable, acceptable, realistic and time specific. And the do part, who is doing what, when and why. Then the check step, evaluation in a nice table, followed by the act. So some adjustments are needed or some follow-up actions. I always end with the stepwise approach with step 3. Keep the skill in balance, as it clearly reflects the mission of the reduction of antibiotic use, in which the responsible team is responsible. So the farmer, the veterinarian, the feed advisor, and of course with the help of the coach. But you see here that there are different Plan, Do, Check, Act circles that needs to keep in balance to reach the mission. So I started this presentation with that you need to prioritize your Plan, Do, Check, Act circles and to choose one. But on the other hand, you do not need to forget the other ones. As you focus on biosecurity, for example, while your vaccination schedule is very bad, then you won't reach your final mission. So in that way, you are trying to keep focus on the integrality of your farm, but try to keep the focus on one thing at a time. So this is the approach we are using in DISARM, and I have some take-home messages from it. Well, of course, unfortunately, due to the corona, our progress isn't that far yet as hoped. So we haven't got some real results about the reduction of antibiotics yet. But we do see some promising results in the improvement of general farm animal health, as well as in the improvement of biosecurity and disease prevention. And it's also promising to reduce the needs for antibiotics in livestock farming. And we do see as well some interesting changes in the mindset and in the perception of participants, of the team members of the DISARM farm health teams. And its powers lies in the synergy between knowledge and expertise, and there is a coherent advice as they are all together. And next to that, coaching and supporting of the farmer is necessary in making changes. That's also something we are experiencing. So that are the key elements, and I hope you have learned something from this. Thank you for your attention, and I'm happy to receive any questions.
Thank you very much, Annick, for this last presentation. Now we have about 10 minutes for a Q&A session about this living labs and all participatory approaches that we implement in Roadmap and DISARM. So first series of questions is about really like the assessment or the evaluation, basically, of those tools or what we put in place there. So how, and that applies, I guess, to both projects. So how do you assess the impact of the living labs or the stable schools or whatever? Do you have case control studies with which we can compare, and how in the end is it possible to evaluate the participatory interventions? And I may add, knowing a little bit of the Roadmap project, but I would be very curious whether that applies to DISARM as well, whether this evaluation or assessment could be also participative as well. How can we involve the actors, the stakeholders in the evaluation of what they're doing?
Well, if I may start with answering the question, I think evaluation is a key element in this approach, in both DISARM and Roadmap as well, and doing it in a participatory way. I think that's also what we are already doing in DISARM. As I explained in the pre-recorded video, evaluation is one of the key elements in the process. So each time we meet, we reflect on the actions we have set over the time, and we reflect and evaluate about the progress. So then we are looking at improvements in technical results, and sometimes it's even possible to look at if the use of antimicrobials is already reduced. So in that way, you make the evaluation really participatory. And I think if you don't do the evaluation part, then the action stays in between and in the middle. So yeah, that's what we experience, that it's a really important element of this approach to evaluate all the actions you are making.
Thank you.
Yeah, and if I should just add something, I think you have already said it, and Nick also in the roadmap, that we are going through some processes also in the living labs where the living lab members are also identifying what indicators to look at and how to evaluate the outcome. And of course, then there is also a number of researchers that can look at specific issues but communicate it to the living labs so that it can be discussed and actually, what can you say, brought into the debate in the living labs.
If I may add, so the starting point for living labs for our living labs roadmap is very different. So in some cases, we have, let's say, data that is available, how antimicrobials are used before the living lab was established. So just looking in a narrow sense at the use of antimicrobials or the practices established on a farm. And there we might have the chance to really evaluate in a narrow sense the impact of the living lab. But this is not the case in all living labs, and it's not all the time the main aim of a living lab. In some cases, the main aim is to improve the collaboration between farmers and vets, or to make vets or farmers aware of the business each of the actors is doing. So these things are more hardly to measure, and I think it could exclusively done in a participatory way.
And I also have a question, a previous question actually, but which is a little bit like about recruitment, basically, of the participants of these living labs, and especially, we know that antimicrobial use is quite a lot distributed amongst the farms and the farmers. So we may have a high user and low user already, and who is actually, you know, volunteering, because of course it's based on volunteership. We're not forcing anyone to be part of our living labs or participatory approaches. So in the end, who is really engaging there, and actually are we able to engage with what we would call the high user, and if not, how those living lab experiences could reach them, because obviously they are one of the main targets we hope we can reach. So yeah, how do you see that issue of what I will call here recruitment? Maybe that's not the right term.
Yeah, I think that if you're talking about high users of antimicrobials on farm level, I think that they are not necessarily directly involved in the living labs. But I think that one of the interesting things about these living labs is that we try to move actually from seeing individual farmers as high users. They may use a lot of antimicrobials, but they are surrounded by a system where there's a lot of alliances, and where maybe the dairy company or the slaughterhouse and the authorities and so on are forming a system around them where some of the real bottlenecks for change is actually. So I mean, it's not just about targeting farmers with high usage. It's about trying to release some of the things in the surroundings of the farmers that make this, for instance, just to take some examples, like what if a farm is constructed in a way so a lot of the farm employees are just automatically using antimicrobials? I mean, that's about the whole farming structure. What if, I mean, so I think that is one of the aims actually of living labs, to try and address the problems on levels outside just farmers and high users of antimicrobials.
Thank you. Annie, anything to add to that, or any experience from DISARM?
Yes, I think in DISARM we also don't have a real target audience, so to say, to have high users or low users. So I think it's rather mixed, the kind of farmers we have. But well, I think that the main goal we have is to create awareness about this approach, and to create it in the sector, and to help all different kinds of farmers to get to know to this approach, and to let them know that this helps in this regard. So yeah, that's something I would like to add.
And maybe one last question that we have here. I mean, could we see in the end living labs as interventions as such for fighting AMR? You know, like, because we tend to consider interventions like, you know, biosecurity strategy, vaccination, or whatsoever. Vaccination interventions would be like something that happens within the living lab. But someone is asking us, could a living lab be an intervention as such? You know, that could be promoted through, I don't know, various policy or whatever.
Yeah, I think so. Yeah, I don't know how to, I mean, yes, I think that it could, and I think that there could be a potential also to, I mean, beyond the project, to have it as a model, and to move between different levels. But and the last thing I would like to say is, like, by addressing the things and initiating a dialogue between stakeholders that were maybe knew each other from the landscape, but did never really work together on trying to solve a common problem. I mean, I think stirring up in the environment a little bit in the discussion, I think that's in itself is a tool.
Thank you. Annie, one last word, maybe, if you want.
Yeah, I think you already see it in some countries that this approach is already implemented in the legislation. After a few years, that it's becoming obligatory to do these kind of approaches. And well, I think that this is really helpful in reducing the use of antimicrobial use. And well, I hope with these projects we will create more awareness to show this effect.
Okay. Thank you very much. We've reached the end of our session. I would like to thank again the organizers, all the speakers, of course, and as I said earlier, the communication and dissemination teams of this project who made this possible, and of course as well the H2020 program who is funding actually these 4 projects, and that is helping us to foster this prudent use of antimicrobials. So don't forget as well to have a look maybe in the poster room of the conference, because there is posters as well from these 4 projects. So you might know, learn more things, more details about what we're doing. And I wish you, a happy day and last days of the conference. It has been a pleasure to chair this session. Bye bye.